Drug therapy for pregnant women is what I'm going to be talking about today during this PSA video. The first topic I want to talk about is constipation. This is a common problem among women who are pregnant, and there are a few things that women who are pregnant need to know. Women should not use strong laxatives or mineral oil while pregnant. They can use bulk producing psyllium, such as Metamucil, and the patient can also use a non medication method of promoting a bowel movement by just simply having their knees elevated while trying to use the restroom. Nausea and vomiting is the next topic. This is a major one, especially during the first trimester, and it is um, usually not treated with medications unless it has become to the point where the baby is not growing or the mother is malnourished. Um, if that were the case, the drugs that are preferred are ondansetron as the first line treatment, which is Zofran, and Reglan, which is only in severe cases and has to be inserted through an IV. Prenatal vitamins, they should be taken daily, and they should begin when trying to conceive to supplement folic acid for neural development. This will prevent neural defects in babies. Apparently, during my research, I found that only 32% of pregnant women had a good compliance to their routine of prenatal drugs, while forgetfulness and vomiting as a side effect of the drug were the major barriers. So most of the time people were just forgetting, but sometimes it was because they didn't like the taste that it left in their mouth and it was making them nauseous, so they just quit taking them, which is not safe because this is a way to help your baby get the nutrients it needs while still nourishing your own body while pregnant. Drugs used to induce labor are dinoprostone, misoprostol, and oxytocin, which is a synthetic form, but it can also be called Pitocin, and that is the most commonly used. It can also not only help induce labor, but it can control postpartum hemorrhage, which is very important if the mother was losing too much blood after birth. Drugs to stop preterm labor. These include magnesium sulfate, nifedipine, and terbutaline sulfate. Magnesium sulfate is just an inorganic salt, and it is particularly useful during pregnancy, especially when preterm labor is expected. This can prevent preterm labor from beginning, as well as stop contractions if preterm labor were to begin. So this is a miracle drug. When I say miracle drug, I mean miracle drug because it can help so many things. It will make sure that the mother is able to carry the baby and to make sure that the baby's not born too early to where it could not survive outside of the mother's womb. So these are some awesome ways to help stop preterm labor. And I know that there are sometimes when that's just not possible, but these drugs do help to make that possible. And here are my references, guys. I appreciate you all watching my video, and I hope you all have learned something from it. It was a blast making this video, and I hope that if you have any questions, you'll let me know, and feel free to leave me any comments that you have. Thanks, guys.